Thank y'all, folks. We'll go ahead and call the Health Subcommittee of Appropriations to order. And you all have your tracking sheets, and what we'll be discussing are just the differences from the governor's recommendation. And I'm going to go through those, and we'll start with that now. 17.1.7, you'll notice is $170,000 saving. This is where the Navigant contract has been completed, and that was a savings that's been able to be captured since that's completed. 17.2.3, this provides funds for operations for the dental board, and if you'll look 17.3.3, same item for the pharmacy board. Those two boards are working together, and there's a $247,000 add that's split between those two boards because they're using some of the same help, and this is to allow them to do the processing of these applications that they have, and so many are having to be almost hand done because having to prove proof of citizenship that first time and some things like that. So they're in need of that money. 17.4.5, this is a $500,000 add. This is to provide for one integrated behavioral health center and one community health center there. So that's what that's for, is to provide startup funds for those two facilities. 17.4.6, this is the increased funding for the AHEC housing resources for medical students who do their 6 weeks rural primary care rotation. This $300,000 will increase their capacity by some 50 beds for over 400 rotations over those period of time. 17.4.7, this is a $50,000 add. This is for the Southeastern Firefighters Burn Foundation there in the Augusta area. 17.4.6, this is to increase contract funds through the Easter Seals Champions for Children for some of those children who do not qualify for the Katie Beckett waiver. They'll take this money and leverage this with their others, and they do a good job meeting the needs of some of those children. One of the things that will be new, if you look 17.5.3, if you'll remember, the legislation was passed in 2003 to provide licensure for the adult daycare center facility licensure program. This fund will get that started at $321,000. There are approximately 200 centers in the state. They would be licensed, and and that's what that is to start that program that we passed the legislation back in 2003. Under the medically aged, blind, and disabled section, the 17.7.1, there's an add there of $566,000. This is to utilize enhanced federal participation rate and increase funds to increase the Medicaid reimbursement rate for alternative living services and personal support services and case managers. And that's that CCSP and SOURCE program. And that's what that is, using those dollars and drawing down federal dollars. Just want to point out to you 17.7.2, the governor added this for us. This is something we've always been interested in trying to do. This was the 25 additional independent care waiver slots that have been added, so I know there's some interest in that. 17.7.7, this item, like a couple of others, will be appearing in 3 different programs. This is to reduce funds to recognize savings due to the increased utilization of the PARIS system. That's the Public Assistance Reporting Information System. This will be used to help determine Medicaid eligibility, and if someone is not eligible, if they're eligible for some other support or maybe even Medicare benefits or VA benefits. So that's where we're coming from with that. There's a $2,000 savings there in that. And you'll see this also now in low income and in peach care. The 17.7.11, this is the reduced funds to reflect the hospital cost settlements. This is just a truing up of the numbers between the community health and the hospitals. There again, this will appear in all 3 programs, ABD, LIM, as well as peach care. That's 2.583. 17.7.12, this is to reduce funds to reflect savings through patient-centered outcome incentives for case care and disease management programs. This is a statewide voluntary case management program that grew out of the Navigant study. This will pertain only to the ABD population, and that request for proposal is open now, and that's where that savings will come from there. 17.8.7, increase funds for growth in Medicaid based on increase to reflect the planning for the healthy babies. And if you will keep in mind there, we're reducing that from the 12.2 to the 8.6, but then on the further down on 17.8.14, you'll see that money. This is just where we're breaking that out to show legislative intent on that, and all it is it's being reduced here, but it's being added in a later spot. 17.8.8, there again, this is the savings recognized from the Paris system that I mentioned to you earlier. $17.8.14, there's the line that I told you about, the planning for the healthy babies, the 3.6 that we just located and broke that out separately there. 17.8.15 is a savings of $1.2 million, and this is the revision of the supplemental drug rebate program from the CMO claims. If you look 17.8.16, there's a reduction there of $225,000 for the Georgia Center for Oncology Research and Education Core. That's removed, and we're going to see that again over in public health because that's tobacco money, so we're moving it out of here, putting it in public health, and we'll get to that in just a minute. 17.8.17, there again, this is just a truing up of the amount of the hospital cost settlements that I mentioned to you earlier. Under Peach Care, 17.9.14, this also is a savings that's recognized from the utilization of the Paris system that we talked about earlier. And then 17.9.8, there again, that's the hospital cost settlements truing up under the three programs that we discussed earlier. Under state health benefits, if you look at 17.10.4, there's a reduction there, and this is part of the governor's initiative and the plan redesign. That reduction appears there, and then if we're going to look over here in a minute in three places, 17.10.10, .13, and .14, you'll see that reappear. 17.10.10, this is part of that, the increase in the benefit packages. .13 is the co-pays for the pharmacy and the ER visits, and also to use prior reserve funds from the budget expense on the 17.10.14. That was part of the changes that the governor had recommended to us in his package. This next item, 17.10.15, is a new item that the committee has added, and I'll read that to you. This says, the board shall contract with multiple statewide and regional vendors for any state health benefit plan offered in calendar year 2015. I know there was a lot of interest in that, so that's what that's in there for. Under the Georgia Board for Physician Workforce Graduate Medical Education, 17.12.3, this is to provide funds for 6 additional family medicine residency slots at Houston Medical Center. If you'll recall, this is the final year of the 4 for the startup of the osteopathic medicine residency program there in Houston County at the medical center. Under 17.12.4, this is an increase on all Georgia Board of Physician Workforce capitation residency grants by $333 each in state funds. There are 1,392 total slots across the state. Of those 1,392, 1,326 can draw down matching federal dollars 2 to 1, so that $333 will mean they'll end up getting $1,000 per slot, which will come to about 1.3 million total out of the 463 that we're going to put in to help them out. Next item is 17.13.1. This is to provide funds to increase the operating grants for medical education at Mercer. There's a 1.8 million grant there, increase. Next item is 17.14.1. This is for the Morehouse School of Medicine. We're adding $5 million to their operating grant there, which still allows them to draw down with the federal funds up to that $30 million number. And what this will do is the federal funds begin to not become very stable and maybe go away. This will help free up some additional upper payment limits through the Georgia hospitals to help go to that, where it'll help the GME slots, Morehouse, as well as the hospitals. And Morehouse is made whole by doing that. 17.15.1, this is to provide funds for loan repayment awards. This is where we were allowing the doctors to serve in underserved areas, and they were getting $20,000 as part of their loan forgiveness. This will bring that funding up to 30. Last year we only had enough money to do 17, but they had 37 requests, so this will help with that, $260,000. Drugs and narcotics, 17.18.3. This will provide for one additional post-certified licensed pharmacist inspector to help with the pill mills as well as make their other drugstore and pharmacy inspections as well. Under public health, 37.1.3. This is where the $225,000 shows up for CORE, the Georgia Center for Oncology Research and Education, because that's tobacco money. That's more appropriate that it be there. The next item, this committee's always had an interest in the 13.11.2. This is for funds for the fourth year phase-in of the grant and aid formula to hold harmless for the counties across the state. This is the fourth of 7 years, $1.34 million to do that. Under the Georgia Trauma Care Network Commission, 37.14.4. There's a $1 million ad with that. This is to help support the trauma center readiness cost and qualified uncompensated care. And members of the committee, that completes our recommendations, and we'll entertain a motion. We have a motion to pass and a second. Is there discussion? All those in favor say aye. 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 Any opposed? Thank you very much.
Matt was opposed. Good afternoon. We'll call to order the subcommittee meeting of the Human Resources and Appropriations Committee. Good to see y'all here this afternoon. I want to thank the committee members that are here too for the hard work that we did. This budget came to us pretty flat, but we were able to do a few things, so look forward to sharing with you those. We agreed to all of the governor's recommendations in GOSEF, labor, and veterans services. So the only changes that we'll be talking about are in behavioral health and also in DHS. We'll start on page 1 of your document. 15.2.9, to provide a 0.5% increase for developmental disability providers. That's $874,000. On page 2, 15.7.3, this is an ad to provide funds to Emory University School of Medicine for fetal alcohol syndrome screenings and treatment, $190,000. On page 3, 15.11.5, to reduce contract funds for technical assistance training and monitoring in our state hospitals. We were able to find and reduce that by $500,000. This is the contract with Dr. Singh. 15.13.1, Georgia Council on Developmental Disabilities, to provide funds to unlock the waiting list for 64 additional supported employment slots for people with developmental disabilities, $250,000. And then if you will skip over the next section, which includes the governor's office, and there are no changes there, we'll go to human services. 27.6.6, to provide funds to increase the annual foster care clothing allowance by $100 per child. That's an add of $460,000 and $816. And then 27.6.7, to provide additional funds for court-appointed special advocates, the CASA program, so they can expand capacity of $200,000. And let's look. And there is one more on page 6. 27.12.3, to provide additional funds for Meals on Wheels and Senior Center nutrition programs. This is an add of $750,000. Just checking. That is all that we have, and I will say too, because I know we have some of our providers here with us today too. I know this is just a beginning. There's much more. The asks were large and larger for each of these, but certainly we're beginning the process now. So if there are no questions, I would entertain a motion.
So moved.
Second.
We have a motion to pass and a second. Any questions? All in favor signify by saying aye.
Aye.
Those opposed by like sign. Thank you. That will conclude our business and adjourn this meeting for today. Thank you so much.
Well done.
Well done. Yeah, is it not have faith?
What?
Nothing.
You ready?
I hate to start before everybody's here, but we will. All right, this is the Public Safety Subcommittee of the Appropriations Committee, and we're dealing with the FY 2015 budget. And what I'm going to do is go through the tracking sheets and only go with the things that are either not system-wide changes and the things that were not recommended by the governor or that we've changed in the governor's recommendations. So in other words, if it's a governor's recommendation that we have not changed, then I won't mention it. If it's a system-wide change that applies throughout the agencies, it's changes that are requested by OPB or others, then we will not be mentioning it. So we will only deal with the things that the committee has taken action on. And so we will start with the Court of Appeals. In line 5.1.5, their request was for 2 staff attorney positions at a total cost with benefits of $354,724. The committee's recommendation was $256,626. And in 5.1.6, the committee recommended that $30,000 be deducted from the e-voting software, which was a one-time allocation from last year. In section 6, which is Judicial Council, I will point out to the committee in 6.1.3 that the recommendation of the committee was to cut that position. The recommendation of Green Door was to restore that cut. And so the recommendation that the committee is being asked to consider is for the position to be stay as the governor's recommendation. In 6.4.1, there was a request for an event coordinator position in continuing judicial education of $39,182. The Budget Committee's recommendation is 0. In Judicial Council, which is 6.5, there was at 6.5.4, there was the governor's recommendation was increased funds for a family law information center in the Patola Circuit, and this committee's recommendation was not to fund that position or that center. In 6.5.6, the governor's recommendation was for $111,363 for salary and benefits for an executive director position for the Council of Probate Court Judges, and this committee's recommendation was not to fund that position. In 6.5.8, this is just a true up. The recommendation was $410,508 when the actual numbers were run through the House Budget Office. It was $395,867. All right, in section 8, which is the prosecuting attorneys, in 8.2.4, the recommendation in the governor's budget was to fund 35 additional assistant district attorneys at a cost of $2,746,864. $2,746,864, and the committee's recommendation is not to fund those positions at all. In 8.2.6, the recommendation in the governor's budget was to fund travel and training increase of $369,713. It was the committee's determination to increase that by $150,000, but not to the extent of the $369,000. In 8.2.7, we got started early, but that means we get finished early. In 8.2.7, the committee will, in a subsequent line item, recommend the funding of 2 new judgeships in the Coweta and Waycross judicial circuits. And as most of you know, in order to put those 2 positions in, you also have to fund an additional assistant district attorney and an assistant public defender. And so in 8.2.7, we're providing funds for the 2 assistant district attorneys that go along with these 2 new judgeships, and that number is $52,261, and that is for a 3-month period of time in the fiscal year 15 budget starting April 1. So it's just a partial year. In 8.3.5, there was a request for increased funds for personal services to reflect promotional increase for experienced attorneys in the Prosecuting Attorneys Council, and that was $25,342, and the committee denied that request, but did approve the request for promotional increases for experienced assistant district attorneys at the court level, which was an 8.2.5. In Section 9, Superior Courts, 9.1.3, there was a request for increased funds for operating expenses of $12,914, which this committee recommended that we not fund. 9.1.4, there was a request for increased funds for personal services for a project coordinator position, which this committee elected not to fund. In 9.1.5, there was a request for increased funds to reflect an adjustment in the employer's share of the state health benefit plan, which this committee elected not to fund. In 9.2, dealing with judicial administrative districts, there was a request at 9.2.3 for increased funds for operating expenses of $135,000. The committee did not feel that they could fund that whole amount, but they did increase the current funding by $50,000 instead of the $135,000 requested. 9.2.4, there was a request for increased funds for personal services eliminated in previous budget reductions of $18,051. It is the committee's understanding that this represents 3 furlough days. And it's also the committee's intention that we are not asking anybody to take furlough days anymore. And so this request was approved at the tune of $18,051. 9.2.5, there was a request for an increase to pay for the employer's share of the state health benefit plan, which was $12,988, and which this committee elected not to fund. 9.3, dealing with Superior Court judges. There was a request for 9.3.4 for increased funds for personal services for salary increases for secretaries of $212,480. The recommendation, you have not seen this before, but the recommendation is that this amount be reduced to $133,674, and that would be where the funding for that $78,000 in the accountability courts, or $68,000, whatever that number was, that's where that number would come from, is reducing the salary increases for secretaries. And then 9.3.10, there was a request for an adjustment in the employer's share of the state health benefit plan, and to be consistent, we denied that request. And then 9.3.11 is provide funds for 2 new judgeships in the Coweta and Waycross Judicial Circuit starting April 1, 2015. And that amount is $180,555. And that was an amount that the committee did approve. Supreme Court. The requests that the Supreme Court made were all approved by the committee, but in addition to that, there were 2 additional matters that were taken up that had not been addressed by the Supreme Court. The first is found at 10.1.10. There was a staff position that was approved for the Supreme Court last year, which we funded for a half a year. And unless we fund the other half this year, it will not be annualized and won't be a full 12-month position. And so that was not requested by the Supreme Court, but we felt like that it was appropriate unless they wanted to just employ somebody for 6 months, lay them off, and then hire them again, which I don't think was their intention. So we funded that at the rate of $62,357, which was for the other half of the year. And then the Supreme Court previously requested funds for digitizing paper records, which was supposed to be completed in 2014 fiscal year, and so we took that money out of the budget for the 2015 fiscal year. We're going to finish without you too. All right, 18.6.4, we're in corrections now. There was a request from the Department of Community Health for $500,000 to fund their nursing home care for paroled offenders from the Department of Corrections, which would equate to $1,500,000 saving in the Department of Corrections, because once they go out of corrections where they're paying full cost and go into the Medicaid system as a paroled patient into the nursing home, the Medicaid kicks in and the state pays 1/3 and the federal government pays 2/3. So that $500,000 request by the Department of Community Health actually equated to $1.5 million savings in corrections. And so we recognized that and then used $1 million of that for the purpose of increasing pharmaceutical pricing expenditures. And so that balances out, but it's just an adjustment in the way that we recognize that money. In section 19.1.4, there was a request by the Department of Defense for a legal position at a cost of $180,063, which the committee felt like was not something that we could fund based on the information we had, and so the committee's recommendation is to cut that amount. Yes, sir, all departments, executive departments do. And the question was, do they not have access to the Attorney General's office for legal advice? And they do. All right, in section 29, which is the GBI, there were 3 changes here. The first one is found at 29.2.3. If you will recall, a couple of years ago, the legislature passed a metal theft law, and part of that metal theft law required that there be a metal theft database created, and that has never been funded, though the law required that it be created. And so after hearing from the GBI and from affected persons on that matter, we elected to fund that to the tune of $150,000, which was not included in the original governor's budget request. 29.3.4 and 29.4.3 are phase 3 of the 3-step pay increase that we promised to the GBI agents, field agents, and the scientists in the crime labs 3 years ago. And this will bring them all up to pay parity with the State Patrol. And the same thing, I understand, was recommended by the General Government Subcommittee as far as DNR Rangers, and both of those have similar qualifications with State Patrol officers, and it was felt appropriate that they be brought up to pay parity, and this will do that. Section 30, Juvenile Justice, 3.1.7. This is a carryover of what we approved in the 14 amended, which was to reflect a 3% rate adjustment among all out-of-home care providers. There's just a language change in the Department of Law 32.1.5. You'll recall when we had testimony on this, there was just sort of as an aside that the Atlanta grade inflation trials were winding down. There were 2 staff positions that were used in the prosecution of these cases and the assistance of the Attorney General's office, and because they have been perpetually short-handed rather than cutting these 2 positions at the end of that, this language just assures that those people will now be transferred into other positions and other duties at the AG's office, so we do not lose those staffing positions. Sir? It's 32.1.5. It's just a language change. All right, in public defenders, which is section 36, in section 36.2.3, we're dealing with, and 2.4, we're dealing with additional public defenders as a result of new judgeships. 2.3 is annualizing the public defenders that we approved last year, but only for a partial year. And then 2.4 is the 2 new public defenders that go along with the new judgeships in the Coweta and the Waycross judicial circuits. We're doing it for 3 months, starting April 1, 2015. The feeling is that we're putting in 3 months of salaries for the judgeships, the assistant DA positions, and the public defenders. And if there is a need that they start earlier, which we have done in the past for January, then the Senate will need to put those funds in there so that it will be a 6-month position rather than a 3-month position. Sir?
What should we read now as far as the bill for the beginning of those judgeships? All that for that when it comes back this January 1 or
I think that if you put into the bill that creates the judgeships beginning April 1, that if the Senate puts in additional funding, that when this bill crosses over, that they can amend the bill to conform with the budget recommendation.
May I ask another question?
Yes, sir.
Why are we not going ahead and do it ourselves?
Because we aren't. All right, 38.4.6 is something we really did not discuss in committee, but it came to the attention that there was a need for additional State Patrol services, and it was either create a new post or increase staffing in the Bartow County post, and so the recommendation that came up from leadership was for an increase in the Bartow County post in staffing, which would be less expensive than creating a new post, and so that recommendation was $348,349, and that's in 38.4.6. And unless I missed something, I think that is all the changes, other than, even though it wasn't a dollar change, in the language changes on corrections. If y'all will recall, in 18.2.2 in the amended, we recommended an increase in the county jail subsidy from $22 to $43 per day. And the Senate said no, and of course that's still being negotiated in the 14 amended, but we wanted to do the same thing in the 15 that we had recommended for the 14. And so that shows up again in 18.2.2 for the 15. But there's not a funding allocation because of that, because there's enough money already in the budget to take care of that. We are seeing that. Certainly I would hope that we would start seeing it in medical, because that's approximately $100 million of their cost. But we're certainly seeing it in the jail subsidy cost. As we pointed out in the 14 amended, we had $9 million budgeted for that. Historically, over the last 3 years, we've been actually spending over budget and having to adjust funds, because they've been spending about $25 million for that every year. And this year we have, in the 14 amended, we budgeted, I think, $4 million, and I think the Senate changed it to $2. And for the 15, I think we're only budgeting $1 million. So that's a $24 million savings just in that one line item of the budget. I don't know that we've got a number of bed decreases, but if we do not have the jail backlog, because that's where we have been warehousing the overflow, then certainly we have a decrease in total number of prisoners. Are there any other questions or comments from the committee?
Move to pass. Second.
All right, we have a motion and a second to do pass. Any discussion? It's already moved. You can just vote now. All in favor say aye. Aye. Any opposed? It is passed, and we are adjourned. Thank you.